Welcome to the Honest Health Podcast with your host, Jeffrey Burke. Honest Health brings you the brightest minds in the natural products industry, as well as athletes and entertainers. Jeff will keep you entertained and informed while educating on how to be successful on your healthy journeys. Now, here's your host, Jeffrey Burke.
Hello and welcome back to the Honest Health Podcast. My name is Jeffrey Burke. I'm so glad you're back. If you're tuning in for the first time, welcome to my platform. If you've been following me for a long time, as many of you have, some of you for decades, I have to say it 4 times, decades and decades, thank you for joining me on the new platform. Really enjoying being able to work with my guests and see my guests and interact with them. A lot different than radio, but it's really, really fun. And as you know, I'm bringing you the best minds in the natural products industry, soon branching off into entertainers, people in the know, professional athletes. Going to keep it fun. Going to make sure that you always have something wonderful to look forward to, but you're never going to know where I'm going to take it, and that's okay. You're going to love my guest today, so sit back and enjoy. Hillary Nitschke began her formal training in herbal medicine at the University of Washington, also receiving a certification from the American Academy of Nutrition. She has created nutritional programs for Ironman, triathletes, and marathon runners. She has studied directly with Ric Scalzo, the original founder and formulator at Gaia Herbs and founder of the Ric Scalzo Institute for Botanical Research at Southwestern College for Naturopathic Medicine. She has traveled in Central and South America to study in the field with Rosemary Gladstar, the late Cascade Anderson-Geller, and Shelley Torgove, and various indigenous healers. She has studied with several natural industry formulators and holistic medical pioneers, including studying and working in the clinic with Donnie Yance from the Center for Natural Healing and creator of the Natura brand. In 2022, she studied with Sam Kaufman and Dr. Kyla Helm, pursuing a functional medicine certification with a sub-focus on botanicals from Sam's school, The Human Path. She's a longtime natural products industry professional, working as an educator as well as in sales and marketing. She had the good fortune to work for Jarrow Formulas for 25 years. An amazing industry insider. You're going to enjoy this today. Help me welcome my guest. Hey, Hillary.
Hi, Jeffrey. And I guess we can make 2 edits. We can add that Ric Scalzo now has the wonderful Kokoro brand, if I'm pronouncing that correctly. Kokora brand, which I'm really excited to get my hands on, and that I'm embarking on a new adventure in the industry, going from finished goods to the supply side. So haven't updated that part of both of those parts of the resume, as Kokora is also new, and my adventure.
Well, talk a little bit about the new venture. Let's talk about the new platform. Where are you going? What are you doing?
I'm going to a French plant chemistry-based company called Group Burke. And until recently, I would say everything was based on plant chemistry with a foundation in grapeseed extract, which I don't know if you knew this, I sure didn't, that grapeseed polyphenols actually deter termites. So there are several different pillars that this business works within. So there's an industrial and a pest control and nutraceuticals and skincare. And now, having just recently acquired Arctic Biosciences, we also have a specialty fish oil processing. So instead of presenting finished goods, I'll be selling ingredients to brands like Jarrow Formulas and probably not Kokora, because they're probably making growing all of their own extracts, but other brands that don't do their own growing and processing.
Well, it's fantastic. I congratulate you and wish you all the luck in the world. They're lucky to have you, and I think you'll be a great addition to their company as well. Congratulations.
Thank you. I'm very excited. Starting next week.
Oh my goodness, how fun. So let's get into it here. You and I have both been around the block a lot. We've been around a long time. We've seen a lot of changes. I like to ask my guests that I have, many of them my friends and my peers, I always ask them the same question. What is something that you notice to be one of the biggest changes in the natural products industry that stands out to you over your entire career? What's the one thing that's like, well, there's a lot, but what's the one thing that you're like, wow, I can't believe this change?
I would say the biggest change is that there are many companies whose sole focus or aim for success is simply to sell to a large, multinational corporation, or, some type of corporation like Procter and Gamble. And it's not that that in and of itself might be a bad end, but one would hope that companies are building a brand and a product line that they believe in, and that maybe it becomes so wonderful and so beloved that a large company wants to purchase it, as opposed to the fact that sometimes this is actually what the initial desire is. We're only making this because we want to cash in on it. And another
Yeah.
big change is that we are seeing grocery brands being picked up and by big suppliers and producers like Pepsi, just buying that Siete grain-free brand of foods for a huge sum of money in the over $1 billion. So I can't say that I keep up as much with the food side of CPG, but to see that, who knew that almond flour cookies and cassava tortillas would yield a $1.2 billion sale, right? So, and those of us who love that brand and who really love the mom and pop stores look at that, and it makes us a little sad. But I think about
Yeah.
those founders who I really do believe were in it with heart, and I'm thinking about the future that they've created for themselves and their families, that I'm happy for them. And I hope that what we will continue to see is that there are brands that are able to, that the heart of the brand maintains true to the original goal of the brand, which in the case of food is to make really healthful and delicious food, or in the case of different vitamin and herbal products, that hopefully some of the brands that sell will still be really wonderful brands at the end of the day, too.
Oh. And I think we're thinking along the same lines. Someone actually asked me the question one time, turned it around on me, and I basically said, I think what I like is the changes in what we had to offer when I first started to what we
Mm-hmm.
have to offer today. We didn't have blends. We didn't have
Right.
formulations. If you wanted a blend, you needed to create it yourself, which
Right.
means you needed to do research from a bunch of
Mm-hmm.
books, and there weren't that many to look at.
Mm-hmm.
And then you had to find out what could be used, and then you had to search it and see if it was even available and if it was even in this country. And then you had to find out how much of it to use. There was a lot of playing around. The person that walks into a health food store, nutritional whole food kind of grocery store today, they walk in, it's a completely different world for them. They can walk in
Yep.
with a area that they want to focus on, and they're able to do it very easily because now formulas are blended without you having to do the thinking. You just have to remember to take it, whether it's
Right.
the eyes or the joints or the skin or the heart
Mm-hmm.
or, other conditions and things that you're trying to get healthy. A lot of the work is done. So for someone that was doing it 40 some years ago, when I first started, it's a lot different today. And I think we have a lot more to offer. And I think that's a much better thing.
It is, although I think what can be lacking there is not only the creativity of the consumer, but the drive to even learn maybe what does each ingredient in this formula represent? Why is it here?
That's true.
And not everybody needs to know that, and not everybody has the bandwidth in life to, suddenly learn all about nutraceuticals and herbals to understand, what is andrographis in my formula? How do you even say it, right? So there's a time and a place for everyone to know those things. And I mean, and that goes into another thing in the industry when we look at allowable claims and what we can and can't say. And that brands are now really looking often for ingredients more based on, is there something we can say on the label that makes us more appealing to the consumer who doesn't know what these ingredients mean? Which, so there's both sides of that. I mean, that's a great thing because these nutraceuticals and herbal products offer such a wealth for ongoing good health, overall just a deep level of vitality and an ability to heal, right? In a way that often we can't necessarily find from the pharmaceutical side, in a way to balance. So having those claims is great, but sometimes the fact that things are based around only can we get a claim versus what are we really trying to create here? What's the holistic nature and the goal for wellness that we're trying to create when we build a product?
I love that. And it's interesting because, I remember when I first started, there really weren't too many limitations on the verbiage.
Right.
And
You could say
and
anything.
then we had ups and downs, back and forth, arguing, fighting, the many wars we had within our own industry, pharmaceutical, medical,
Mhm.
all that kind of stuff. And then of course Deshay came out, and kind of gave us parameters, which is something we're still looking to and following today.
Right.
But it's very, very easy to step outside your limits of what you can be talking about, because it's just the way conversation flows so easily today.
Sure.
And things that were maybe taboo subjects for such a long time are now more in common conversations.
Right.
So sometimes I catch myself,
Hmm.
sometimes, and I'm just like, I can't say that, so, I want to say it, and I should be able to say it,
Right.
but kind of I don't, and I stick to the parameters, and I
Right.
respect them.
I
And
respect
I
them
think
as
that's kind
well.
of keeping us in kind of in line, if you will.
Yeah, I respect them as well, but it's a little unfortunate when it comes to people that don't have the knowledge or necessarily
Hmm.
understand what the benefits might be and might be missing out on something because it's hard to learn about it based on what we can
Hmm.
and can't say. It just reminded me, and
Agreed.
maybe this is going off on too much of a tangent, but when the very first Deshay laws were going into effect, I was working in a natural food store in Oklahoma City that is no longer there, called the Earth Natural Foods. And I got a phone call from the local news station. We want to come and interview someone at the store to talk about this change. And so I called, thank goodness I already knew him. I called Mark Blumenthal right away. I was like, they're coming in to interview me. What do I say? And I wish I could remember what he told me, but I pretty much said verbatim what Mark told me to say, um, to the people in the news. And that was, my goodness, that was 30 years ago.
I know. I don't know how this happened. I don't know how it happened. I mean, we're what, in our 30s now, so I don't get it.
Right. I know.
So so, another area that I know you're very passionate about, as am I, is the relationship between preventive and health and life choices and supplements and herbs and living a healthier life, Ric Scalzo's words, a life regenerated, that we're
Hmm.
taking care of ourselves, and we're thinking about today, but we're thinking about down the road. Just like with regenerative agriculture, you're thinking about today's crop, but you're thinking about the ground for your generation's generation. So
Right.
that's important. Our relationship with the medical community has changed a lot.
Hmm.
And it's interesting to me how I see handwritten prescriptions coming into health food stores now, and it's got a little bit better. What do you think about the medical community today? Because I have some great friends in it, but it's. Mm.
Well, and I also, back to our age, I mean, I'm old enough to remember when doctors made house calls when I was a child.
Me too.
That's not even no one would even consider such a thing. These days, I
Mm-mm.
don't think, maybe some concierge practices certainly would, but for those that can afford that. Um, I have two children, and they would both be dead if it weren't for modern medicine, if it weren't for antibiotics. And when you think about the number of lives that antibiotics have saved, I mean, bar none, that's a class of medications that has saved lives beyond any other class of medications, if I'm not mistaken. So I
Mhm.
have a great respect for modern science and modern medicine. And by all means, and I'm sure you've heard this said exactly before, if I break a bone or I have a heart attack, if I have an acute something going on, then by all means, take me to the hospital. But if I have a chronic inflammatory condition or I get a virus, then, take me to the herbal apothecary and let me either, put together a formula myself or get an expert who knows how to do that, that can really look at, and even a common cold, you might have it more in your chest and that's your weak area. And different colds are going to have different symptomology. I might get it more in my head. I also, um, you can have these reactions in your body too, right? You can get what's a typical upper respiratory infection, but the inflammatory cascade causes me sometimes to have a terrible neck ache, or somebody else with a, weakness to have terrible back spasms in their low back. And I say this to certain people and they're like, that, what are you even, how could you possibly think that a head cold is affecting your back or your bad knee? And I'm like, well, you believe that the rainy weather is affecting your bad knee, right? I mean, so that's not even in your body. So what about, we're attached all the way around, right? I mean, each part of us is connected. And so what we don't see in most drugs is the ability to really work on that connection in a vitalistic way, in a regenerative way. And yet with herbal medicine, we see that. With certain nutraceuticals and anti-inflammatories, we see that. We see things that are balancing, right? That can help with, both something that's energizing and uplifting, and yet helping with regulating sleep cycles, like ashwagandha, right? There's not a drug unless it's a 2-part, slow release tablet, that part of it is energizing and part of it is relaxing. There's no drug that can do both otherwise, right? I mean, the wonder of nature. We still don't even know exactly we can't really identify all of the things in bee pollen. I mean, we can give value to nutrients, but the holistic effect of it, we don't know all of the things that make it do what it does, right?
You make such a really good point. We have to understand that, you made that point about the rain. People say, oh, there's rain coming. Every time the humid comes out, I can feel it in my joints. And that's an outside irritant, adjutant, and it's not even connected to us. So, the other part for me is the mentality that's always been such an obstacle, where people have used a pharmaceutical for a situation, and it worked, gave them some kind of cover up or relief very quickly. And then they decide they want to go more natural, and it takes a longer period of time to be able to put the balance in place. And that mental part of that, they're not wrapping their mind around it.
Right. Well, a lot of that, and it's probably not only the American way, but that bigger, better, faster, more. Like, I want it to work yesterday when I'm taking it tomorrow, and I really want it to hit me over the head with the effect. But again, when you think about regenerative health, this isn't something that most of the time, a dramatic change like that is too hard on your body anyway, right? And especially if you're debilitated in any way, to rebuild, to find foundational wellness, this doesn't happen, with one pill. This doesn't happen with just, I'm going to snap my fingers or wave a magic wand. Usually it's a matter of many different things in the body recalibrating. And again, most drugs are targeted towards one thing, as opposed to herbs that are working, or other or nutraceutical vitamins, minerals, different ingredients that are working on a much broader level to bring back balance.
I think I saw this really, really vividly when Prilosec came on the market. It was like one of the first commercials on television for a drug. And I remember vividly, there was this woman running through a field of flowers, picking up flowers, basically saying, no more gas, no more bloating, I'm fabulous, everything's great. And the next day, every phone in a medical office in the United States started going off the hook, because everybody wanted to run through a field of flowers and get rid of their gas and their bloating and their heartburn. So it was made prescription, and it was like $600. It was very expensive, that people wanted to get it. And then when the patent ran out, now you get omeprazole and things like that over the counter. But nobody read the box that said use it for 2 weeks.
Right.
And people have been on it for years and years and years. And it's one of those things where when you have, you have dyspepsia, you have gastritis, you have upset stomach, you have nausea, you have irritation of the throat, you burp a lot, and you use something that makes that stuff seem like it's gone, you're hooked. And you will argue with anyone right to the point saying, it's gone, I fixed it. Well, no, you covered it up. Right. And, so now we're seeing the ramifications, people that have been on these for a long time, and now their new doctors are saying, you can't be on it this long, and they're taking it off. And all of a sudden they're going back to where they were before, and they're remembering how much they suffered. And now they're going into the health food store and getting the probiotics and the enzymes and the greens and things they should have done 10, 15 years ago, and they didn't. And my friend went in, she's been on, I'm turning blue arguing with her about this. I love her dearly, but she's been on it for over 15 years, and she's 60. and she went to her doctor, and they told her she had the bones of a 90-year-old
I was about to
woman.
say, what's
And the
happened to her
doctor said,
calcium absorption? Yeah.
yeah, she was absorbing nothing. And he
Hmm.
took her off of it completely. And she's having to follow a severe protocol, even pharmaceutically, adapted as well, just to get that bone structure. He said, if you fall down, you're going to shred your body into pieces. Your
Hmm.
bones are so fragile. That's something else we don't think about, because I know it's hard. Life is hard. Life is rough. We're juggling a lot of things. And if you use something that makes you feel good, and even if the symptoms are just going away, your
Hmm.
mind says you fixed it.
Right.
So
Yeah. It's a
where
tough
do you
one.
think we're going with the medical establishment? Do you think that we're going to be continuing to connect a little bit more? Is there going to be more of a melding, or are we just going to kind of run parallel?
Yes and yes. I think there will be both, right? We're seeing
Okay.
that um, certain physicians are understanding that they have to get up to speed with what their patients are doing, right? There's that. Like they need to understand that. And then and or when a patient comes in and they've got really good results, that physician wants to share that with other people, presumably, right? Because they want their
Hmm.
patients to be healthy. So there's that
Of
side of it.
course.
I mean, there are some people that are just going to keep, this is what I learned, this is what I know, and I'm staying in my lane. And then there are others that are figuring out, and even, I mean, look at COVID and cytokine storm and things that there just aren't necessarily great drugs to manage inflammation at that level. And so it's forcing the medical field to look at, okay, maybe we missed something all along when we haven't properly managed inflammation. And it was funny when you mentioned Prilosec. I was like, before you got to that word, before you got to that part of the sentence, I was like, oh, he's going to talk about COX-2 inhibitors, right?
Mhm.
Because that's a whole other class of drugs that, on the one hand, when you're in pain and you take a COX-2 inhibitor, an NSAID drug, although there are other drugs that aren't NSAIDs that are, anyway, and you feel better, you want to keep taking it. There are people that take
Of course.
ibuprofen and they call it even vitamin I, right? And they take it every day. And if you can tell them, you're going to cause bleeding ulcers, and, you're going to really damage yourself irreparably, potentially. And they don't care because, like you're saying, well, but I
Mm-mm.
feel better. I feel fine. I must not be having that side effect because I don't feel it. And I'm like, well, you probably are. You just don't know it,
Yeah.
So it's
Agreed.
very hard to get people to understand, that most side effects are actually effects that happen to the vast majority of people that take a medication. They're, not often rare effects. They're usually common side effects, the ones that we know about. And it's tough to get people to understand. But there are all sorts of things, from curcumin to fish oil to ginger to combinations, with ginger and hops and different things, that when they work together, that actually can modulate inflammation. But again, not the day that you take it necessarily. Some people will get quick
Yeah.
results, but many people that have chronic pain, you didn't get there overnight. So you're probably not going to get better overnight. It's going to take your body a little while to regenerate. I'm going to stick with this regeneration theme that you started in the beginning.
Well, if you look at countries around the world, there are many countries that work in the idea of the entire body.
Hmm.
They know that if there's a weakness or a problem one area, it's coming from someplace else, or it's connected, and they treat the whole body. Where it
Hmm.
seems like in America, and I know I don't want to generalize, but it seems like we focus more on the symptom and the annoyance rather than
Right,
how the annoyance happened, how it started. And we will
right,
go to the doctor and say, can you make this thing go away?
right,
And they don't really jump on and say, well, how did we get there? What are you
right.
eating? How are you living? How's your stress?
Hmm.
How's your rest? How's your activity? It
Right,
doesn't go there. And
right,
there's that missing link that we're missing completely. And we know better. I mean, people understand that if something's happening, there's usually something else we're doing that's probably bringing it to us,
right.
but maybe we don't care.
Well, maybe we don't, and maybe we're just ignorant. And then we have our medical system with our insurance system, where doctors have to see a certain number of patients a day. They only get a certain number of time with each
Agreed.
patient. So that's a problem as well. And yet then it creates an even more classist availability of medicine, when concierge doctors are charging a fee that's, unobtainable for most of us. And yet they're doing it. They're not doing it to be classist. I don't think, not the ones that really care. They're doing it because they want to actually practice real medicine. They want to spend more than 15 minutes with the patient. They want to be able to teach them about how do you eat, how do you rest, all the things that you've just brought up. So, what I would love to see is a return to more of that, allowing doctors more time with their patients, and insurance not railroading the practitioner into not being able to offer that.
How do you think we as the industry handled the pandemic?
Good question. On the one hand, I think we got a lot of information out there as quickly as we could, and yet we're really
Mhm.
hamstrung back to the beginning of the conversation of what we can and can't say, what's
True.
considered, legally, what's within our DSHEA guardrails. So that made it difficult also. And I think, my goodness, certainly any grocery store, not even a natural food store, grocery stores and drugstores and places that were staying open because they had to. Those are real heroes, the people going to work every day in that environment. And it became very contentious too, the who's wearing a mask, who's not wearing a mask, how people felt about that. But then when you look at the people specifically in the natural food stores that really were the community care centers in so many places for what should I take? I'm afraid I've got a very sick parent. Any number of things. Like I'm afraid for my children. I can't go see my ailing parent in the hospital or spouse. That and this is something we've always been, right? These community care centers, but it became even more so, especially even the stores in the beginning, maybe that ones that didn't have food, so they maybe weren't considered emergency, so they weren't really open. But I know there were many that remained open and would, bag things up for people, bring it to the door, that sort of thing. But then the stores that were open, again, being people just being able to have community even behind the mask, I think was very important for everyone. So I would say by and large, we probably handled it, as well as we possibly could, given the gravity of the situation and the fear involved for a lot of people.
I traveled a lot during the pandemic, and and the only thing I really liked during it is there was like 4 people on a plane.
Right. That was
That
pretty.
was really nice. But I went to so many different places, and the mentality was different strategically all over the country.
Yep.
Like to your point, you had the mask situation, you had the 6 feet issue, you had the people that did nothing, you had the people that was doing everything. I was in airports that if your mask wasn't on, they would actually walk by, pick up your mask and pull it up over your
Wow.
nose. It was intense, and arguments and fighting about things like masks, and oh my good, it was a terrible time. I hated it.
Yeah. Yeah.
And out here in Las Vegas, there was a lot of stores that were not allowed to open.
Hmm.
If you didn't have foods at your
Right.
store, you weren't
Hmm.
allowed to open. And I kept thinking to myself, these guys are all essential. It was
Right.
funny, and we laughed about it because the dispensaries and the liquor stores and all of those stayed open because they were essential. But
Right.
the vitamin stores, if they didn't have food, they were somehow deemed not essential.
Hmm.
And to me, that was just very, very frustrating on many levels. But to your point, I think we did as good as we could do with what we had to
Hmm.
work with in a situation that we'd never been around or experienced, that was changing in the philosophy daily.
Right. Right.
Wow.
I do think it brought more people over to our side, if you want to put it that way,
Hmm.
like people that had never thought about what does zinc do? What does melatonin do? What does quercetin do? Why do I need vitamin D? They were dispensing zinc in hospitals, right? And checking
Yeah.
vitamin D levels for the first time. So, um,
Yeah, it was an interesting time.
yeah,
I'm glad it's definitely in the rearview mirror,
right.
but it still has left a lot of damage in its path, if you will,
Hmm.
in so many different areas, both the mentality and businesses and supply chain and
Hmm.
prices and just all many different kinds of
Right.
things. I think that people to your wonderful point, I think it did bring people over to this side because there's a lot of people that never stepped foot in a health food store before, or
Right.
many people that had not been in a while and they're suddenly like coming in. People said, "What do you think it was that brought it in?" And I think you mentioned this: fear,
Hmm.
unknown, not knowing what to do, confusion. If you were watching TV, you were totally confused.
Yeah.
You know, I have many friends that were at home and they were working from home and they were trying to homeschool, and
Oh my
they
goodness.
would
Yeah.
call me and they're like, "Oh my goodness, Jeff, I don't know any of this stuff. I was a terrible student. I can't even do this. I don't know fourth and fifth grade stuff. This is crazy." So that
Hmm.
was stressful as well. I think stress was off the charts.
Yes, indeed. And it, to an extent, has remained off the charts for, that's a whole different podcast we probably don't even want to talk about. But, people are very stressed. And that's another, brings it full circle to the drugs that are available for anxiety and mood and stress do not support regeneration. They do not
Mhm.
support our well-being. They do not get us back to a place of rest and digest, right? That's not even mentioned with most typical allopathic doctors, like that, even helping a patient to understand that if you stay in this elevated fight or flight, you're not using your nutrients, right? You're not, when you're not resting, you're not regenerating, you're not helping your cells to help you, right? There's so many parts of why we need to help ourselves get out of fight or flight. And it's hard. I mean, when you're riled up and you do have fear and there are real things going on in your life that are, debilitating. And again, I'll go back to fear because that's such a big one that, but when we learn that even, taking an herbal elixir, right? That can, and part of it is even just the meditation of I'm heating the water, I'm mixing in these herbs, or I'm, even if it's something that's a powdered blend, I'm putting it in, I'm combining it. I maybe even setting some intention around it when I'm ingesting it, that this is all part of how we get to foundational wellness and how we come back to optimal vitality that some people may never have had, you know? And that's what we're not learning from our doctors.
I love that. You just gave me a memory. I had a friend of mine. He was born and raised in Japan. His family was very traditional, and he moved over here. He wasn't traditional except for one thing. He every night would come home from work and he would do his green tea. It was like it was a routine. He
Mhm.
would set out the he would boil the water, he would mix, he would stir it a certain way, he would make his tea, he would let it steep. It was something that he involved himself in physically and emotionally and spiritually. And to him, that was his ending the day and beginning his home part of his life.
Mhm.
And nothing stood in the way of that. That was an every night thing. Come home, kiss his wife, hug the kids, and then he did his tea thing, and his wife would join him. But
Mhm.
he said it was just so important to him, and even when he traveled, he brought all of that with him because that is the
Wonderful.
way that he ended his day, and
Right.
it was tradition that he had learned from his very traditional
Mhm.
family. He said that was the only tradition I carried on, but it was important to do it, and I know he still does it today. So there is a
And
part of that where you involve yourself in it. Thank you for mentioning that.
right. And our bodies teach our minds and our minds teach our bodies, right? So
Mm-hmm.
if we can have those cues that can help us get back to a restful state, whether it's, again, brewing the tea or taking measured deep breaths as we're getting ourselves to sleep, that if you can just get yourself to that place where, okay, I'm taking this many deep breaths with this many seconds in, hold it for a second, this many seconds breathing out, that alone, you can set up that habit that then your body know, okay, now I'm going to sleep, right? And maybe that's combined with a tropho-restorative elixir that has some chamomile and lavender and lemon balm that you've done beforehand, or maybe something higher tech, right? Like apigenin and, melatonin. But again, making these things ritualistic so that we are continually teaching ourselves and reminding ourselves where we want to be and how we want to be in the world.
With the state of affairs today in this country, what are three things that you think we should all be doing? It could be any three things that come to your mind that could make our life better And they don't have to be difficult things. They could be something very easy.
Well, taking deep breaths, like being mindful of how we breathe, right? Where we're filling the lungs and filling the belly, and learning how to connect our breaths, right? The in-breath and the out-breath remain connected, and allowing a place for, even if it's fear of, when you pause in between breaths of, now I'm not breathing. Okay. Trust that it's coming next. So that would be my second thing, like trust but verify in all things, in this world where we are inundated with information, and sometimes it's not true or real information, even within our industry. That trust but verify is a really good mantra to have throughout the day. Gosh, that's two things. I don't know. Get your hands and feet in the dirt.
I knew you were going to
For
go
me,
there.
like
I
I'm
just
a
knew it.
gardener. So certainly for me, it's get my hands in the dirt also. But if you don't have a garden, anytime, not anytime, you don't always have to rip your shoes off, but given the opportunity to be barefoot in the grass or on the ground, that this is an important habit that should be part of people's very frequent life, if not daily, to remain grounded. And then that circles back to the breathing, right?
I love that. I love it when I'm really kind of need to regroup. I'll go down and I'll hug my horses. There's something about an electricity that, to me, that comes from my horse through my body all the way down to my feet. It's a grounding. People say, "Why are you smiling? You're cleaning up horse manure." I said, "It's fine." I said, "I'm
Right.
regrounding." And I said, "My horse has got his head on my shoulder and I'm regrounding." I said, this is important. We don't take the time to do something
Right.
as just breathe and regroup. And I love your idea about trust and connecting with the earth. I think it's important. I love being barefoot in a garden. I was raised in the Midwest. I love it. So I know these have been wonderful things, and I'm hoping that you're going to come back again, because I think you and I could do some amazing segments together. Will you come back again?
I will definitely come back again, happily.
I'd love to have you back again. So to end this today, give everybody your thought for the day. Hillary's thought for the day, something that means a lot to you that you want them to remember you by.
Can I say something I've already said, which is trust but verify?
Yes. Because I think that's important, and I think we don't do that enough. It's very, very true, and thank you for bringing that up again. I really enjoyed having you here today. It's been a pleasure, and you've done such amazing things in this industry, and we're continuing to keep doing what we're doing. And I'm wishing you all the luck in the world in your new journey. I think you're going to be phenomenal.
Thank you.
Thank you for taking the time to do the podcast today.
Oh, my pleasure, and I will look forward to doing another one
That'll
to
be
3
wonderful.
more with you.
We do it. I'd love to have you back again. That'd be great. Thank you, everybody, for being here today. I hope you enjoyed this. Remember, if you go to my webpage, drjeffreyburke.com, all you have to do is tap on the Honest Health logo. It'll take you to Spotify. You can then listen to any of the audio recordings of the shows. If you tap on the YouTube logo, it'll take you to YouTube, and you can watch the interview as well. So make sure you bring your friends, you bring your family, you bring your enemies, bring them all. We're all about connecting each other and paying it forward and getting people good, solid, truthful, and honest information. That's where we come from, Honest Health. We want to make sure we're bringing the best of the best information. I'm bringing you the best minds, the best of the best in the industry. So just make sure you tune in, because you don't want to miss anything. You may be learning it for the first time, or you may be remembering because you forgot about it, which does happen. Have a wonderful day, everyone. Take care of yourself, and God bless.
Stay tuned for more information from the Honest Health Podcast with Jeffrey Burke. And make sure to check back often for interviews and conversations from the guests we all want to hear from. I'm John the Announcer. Thanks for listening.